Pleasure to be here. I'm going to speak about Mystic Health, which is the name of this practice, this company that's launched, but it has deep meaning to it. It's very personal to me. I'll begin by some disclosures. As mentioned, I've worked very closely with two nonprofit organizations, MAPS in the United States and Therastil in Canada. These organizations have paved the way for access to psychedelic medicine through research and advocacy. I'm faculty at McGill University, where I teach mindfulness to medical students. I'm an attending physician at the Jewish General Hospital. I have some research funding listed, and I've been involved in training healthcare professionals to provide psychedelic therapies as well. So my personal healing journey started at the age of 2.5 when I lost my mother, unexpected, quick loss to cancer, and I grew up without having any conscious memory of her. And this journey of healing, of walking towards authenticity, using tools like mindfulness and altered states of consciousness has led me to where I am today. I never intended on becoming a palliative care physician, but once it actually happened, I realized I'd become the caretaker that would take care of someone like my mother. And in this process, I've healed my own trauma and continue to do so. So palliative care is a multidisciplinary approach to care that involves taking care of individuals with a life-threatening illness all the way to the end of life. This includes their loved ones. It's a very holistic approach to medicine that focuses on quality of life rather than simply extending life. And palliative care is revolutionary. The term was actually coined at McGill University, and it's changed the quality of care at the end of life significantly. But in terms of tools that we have to address psycho-spiritual pain, existential distress, and demoralization, which are extremely common, we don't have any standard available tools in conventional medicine. And so the statistics are staggering that 25% of the Medicare budget goes to the 5% of patients in their final year of life. And a lot of that is due to the extreme suffering that takes place, a sense of desperation to say goodbye to everything we've known and loved. And a lot of these treatments that are done are reducing the quality of life, shortening the lifespan, and taking away the final moments an individual has to spend with who they love the most. And I'm all about having advanced medicines, and the price tag has no limit, but we have to be honest when communicating with patients. What are you going to get out of a given treatment? And that communication often fails. Research shows that the majority of patients are suffering at the end of life. They have unmet existential needs, and I see this in my practice all the time. And this is part of the problem that we have aimed to solve. Research supports it, our clinical practice. In Canada, we're able to use compassionate grounds to access psilocybin-assisted therapy for this sort of distress, and it's been profound to witness the healing that can take place at death's door. Now, this concept that is very relevant for end of life, so if we think about Mystic Health as an infusion of spirituality into medicine, what does that mean? That is not about dogma, it's about connection. It's about a balance between this state of full ego that is a construct designed to separate us from our environment to help us survive in a complex and dangerous world, and come to the balanced state with connection to the rest of being, perhaps feeling one with the rest of being. For religious people, this could be a religious experience, and there's nothing wrong with that, but we're not talking about religion here. We're talking about connection to self, to others, to our environment. And healing can take place at any stage in life, regardless of our disease status. And we have this opportunity to tap into trauma, and out of the correct processing of trauma we can have post-traumatic growth versus post-traumatic stress. And the other piece is about incorporating technology into this. The reality is these therapies are extremely time-consuming. Many clinician hours go into this. They're very expensive and inaccessible. We're using tools like group therapy, for example, to be able to help. But technology will play a role. As you've seen, artificial intelligence is coming, and it's going to do all kinds of things, most of it very useful. On that ground, we actually argue that AI needs to have a moral framework. This idea of mystic health for the AI, the idea that us versus them mentality, which is prevalent in the world, is ultimately against our total well-being as beings on this earth. And so we're all about applying technology in the right way at Mystic Health. Now, I'm really proud of the team we've built, and the team is expanding, and I have colleagues like this next to me that I'm super grateful for. So we have a multidisciplinary team that's really providing excellent care and helping us pave the way on this frontier of medicine and consciousness. And so what we have is this therapeutic ecosystem that involves the mind, the body, and we're rolling out all kinds of amazing programs. And we're really excited about our partnership with Dr. Brochure, Dr. Houman, and this whole institution, because we're going to be doing amazing things together. These modalities, and building on Dr. Kinesi's talk, are so powerful. And so some of the work we're doing involves perioperative protocols and how we can help patients approach surgery in their best form and recover as good as they can. We're really excited about the research that we're going to be doing together with the I&I. Really, there's so much unknown. The core of this idea of mysticism is the mystery of what we are and what we're doing here, what is our purpose. And so hopefully together we can shed light and bring some answers. With that, if anyone's interested in collaborating or supporting us, please reach out to myself, and Grace is here from our team. And I'm very grateful for our gracious hosts. Look forward to a wonderful evening.